Hi, my name is Cindy Bertolino, and I am a F&P student at Maryville University, and today I will be completing the complete head-to-toe assessment. Prior to the assessment, I have asked the patient to empty her bladder and change into a gown. I have also taken the patient's vital signs, her height and weight, and I have also performed the Snellen vision screening for distant vision and the Rosenbaum for near vision, and these both test cranial nerves number 2. I am also going to ask the patient a few questions just to make sure that she is alert and oriented. Can you tell me your name?
Shauna Goldkamp,
And your date of birth?
01/25/87.
And what year is it?
2017.
Okay. In addition to that, as the patient entered the room, I also observed her gait and her general appearance, making sure that all of that seemed adequate and appropriate, and her gait was normal and no abnormalities there. Throughout the exam, I will assess the patient's skin with each system as we progress from head to toe, assessing the color of the skin, any abnormalities with each system. We'll start with the head. Head is normal cephalic, no lumps or abnormalities felt. I'm going to ask you to go ahead and open your jaw. Testing for TMJ, no abnormalities felt there. Also looking to make sure that everything on the face is symmetrical. Eyes placed symmetrically, nose, mouth, everything looks symmetrical there. I'm going to go ahead and ask Jana to close her eyes, squint her eyebrows, puff her cheeks, smile, frown. Okay, you can open your eyes. And then I'm also going to go ahead and take a Q-tip and test for sensation. Close your eyes, Jana, and I want you to tell me if this is sharp or dull.
Dull. Sharp. Sharp.
Okay. And then, Jana, I want you to tell me where I'm touching you on your face.
Forehead. Cheek.
Okay. These are testing cranial nerves 5, 7, and 12. I'm also going to go ahead and palpate the sinuses, frontal sinuses. Any pain?
Nope.
And the maxillary sinuses?
Nope. No pain.
Okay, great. Moving on, we're going to go ahead and look at the eyes. I'm going to look at the eyebrows. There's normal hair distribution. The eyes are also symmetrically placed. I don't see any lesions, swelling. The eyelashes are distributed normally. I'm also going to look at the sclera. The sclera are nice and white, no jaundice. I'm going to look at the conjunctiva. They're nice and pink and moist. I will palpate the lacrimal glands. Any pain?
Nope.
Okay, I will also note for any excessive swelling or tearing, and none noted there. I will take my pen light here. I'm going to check your pupils for reactivity. Your pupils are both equal, reactive, round, and to light accommodation. I will check both direct and consensual light accommodation. And that looks normal. I'm going to go ahead and check your extraocular movements. I want you to keep your head straight and follow the pen light with just your eyes. And for accommodation and convergence, which is normal. Next, I will go ahead and do the cover-uncover test. Sean, I want you to take your hand and cover one eye, and I want you to focus on a distant object approximately 10 centimeters away, and focus on that object for a few seconds, and then uncover that eye, and I'm going to note for any strabismus and there is none noted. And we will do this both bilaterally on both eyes. This is checking that cranial nerves 3, 4, and 6 are intact. I'm going to take a deeper look into your eye, Jana, with the ophthalmoscope. And I'm going to look and make sure that there's the red reflex in both eyes. And then I'm going to look deeper into the eye. And I'm noting the optic disc looks normal, the vessels look normal, and I see no abnormalities. We'll do this on both eyes. Moving on to the ears, I'm going to inspect your ears. Look nice and pink. They're symmetrically placed on your head. I don't see any abnormalities, no lesions, no drainage. Bilaterally. Any pain when I tug on your ears?
No.
Okay. Looking into your ear, I'm noting any excessive serum buildup. I'm noting your tympanic membrane is pearly gray, no bulging. Your bony landmarks are all visible. And we will do this on both sides. And that side looks normal as well. John, I'm going to test your hearing. I'd like for you to cover your ear. I'm going to whisper a word. I'd like for you to repeat it.
Apple.
I'm going to whisper another one.
Banana.
Great. And we'll do that again on the other side.
Grape. Plum.
Great. I'm taking my tuning fork and I'm going to ask for you to tell me if you hear this equally on both ears.
Yes.
Okay, that is the Weber test. I'm also going to perform the Rhine test. I'm going to place this on the mastoid process. Tell me when you no longer hear this.
Now.
Okay, and I'm watching the clock when tell me when you no longer hear it. I'm watching the clock while I'm performing this test.
Now.
Great. Air conduction is twice as long as bone conduction, so it's important to watch the clock when you're performing that test. Your nose is placed midline on your face. It's nice and symmetrical. I see no deviations. Your nares look patent. I'm going to go ahead and have you take your finger and occlude one nair and take a deep breath in. And do it again on the other side. And that sounds normal. Looking closer into your nose, I'm visualizing the turbinates, which look normal. I see patent nares with no drainage, normal nasal mucosa. Go ahead and open your mouth, Jana. Go ahead and stick your tongue out for me, Jana. I'm looking back at your tonsils. I do not see any exudate. You would grade the tonsils and make sure they are not occluding the airway. Say ah for me. Looking at the uvula, making sure the uvula moves appropriately. It's midline. I'm also looking at the both the hard and soft palates. The oral mucosa is nice and pink. I see no lesions. The lips are nice and pink and moist. No cracking or drying of the lips. Smile for me, Jana. Your teeth all look like you have an appropriate number, and they look like you have good dental hygiene, no caries. Stick your tongue out for me, Jana. Move it side to side, and lift it to the roof of your mouth, looking at the movement of your tongue as well. I'm going to take the tongue depressor and check your gag reflex. And we have a positive gag reflex. That tests cranial nerve 9 and 12. 9, 10, and 12. Inspecting your neck looks symmetrically normal. I'm going to palpate, and I feel no lumps, nodules. Your trachea is midline, no deviations. I'm going to look, I don't see any JVD distension. Okay. Palpating for lymph nodes, preocular, postocular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chain, supraclavicular, infraclavicular, and axillary. And we should feel no swelling or enlargement, and all of those lymph nodes feel normal. I'm going to palpate your carotid pulses. We do this separately. They are both 2+. Also, with the bell of my stethoscope, listen for any bruits. No bruits noted. I'm also going to check your thyroid. I'd like for you to swallow. And no goiters noted for the thyroid. I'm going to check some active range of motion and passive range of motion, Jana. I'd like for you to go ahead and take your chin and bring it to your chest, and then up to the ceiling. Take your ear and bring it to your shoulder, and your other side. Push your hand against my hand and this one, and then shrug your shoulders. And again. And that is checking cranial nerve number 11. Moving on to the upper extremities and the nails. The skin is pink and dry, no flaking. The temperature, checking it with the dorsal aspect of my hand, is nice and warm. There is no clubbing of the fingernails, no excessive ridging. The capillary refill is less than 3 seconds. Radial pulses and brachial pulses on both sides are both 2+. I'm going to check your muscle strength, Jana. I'd like for you to push against my resistance and again pull, and on the other side. Great. Next, Jana, I want you to stick your arms out, and I want you to have them up towards the sky, and then pronate. I want you to turn them like you're turning over a cup of liquid. Great. And then can you take your arms and bring them all the way up over your shoulders? Any pain? No. Great. Moving on, we are going to assess your lungs. I'm going to have you turn around facing the wall for me. I'm going to start with the just visibly watching the respirations, making sure that I don't see any use of accessory muscles and that the respirations are not labored. I'm also checking the color of the skin. That is normal. I'm going to check for expansion. Go ahead and take a deep breath in and blow it away, and that is symmetrically bilateral. I'm going to check for tactile fremitus. Can you say 99?
99, 99, 99, 99, 99, 99, 99.
Great. And tactile fremitus is equal bilaterally. Going to percuss the intercostal spaces. And we should be hearing resonant sounds. And we would also do this laterally as well. And that is normal. I'm going to percuss for diaphragmatic excursion. I'm going to percuss from resonant to dullness. Take my pen or a piece of marking tape and I'm going to mark that area. And then, Jana, I want you to blow that air out and then take a nice deep breath in. Breathe normally. Okay, and take a nice deep breath in and hold it again. And I'm going to percuss from dullness to resonant again. And I'm going to mark that spot. And that distance should be 3 to 5 centimeters. Great. I'm also going to check for CVA tenderness. Any pain?
Nope. Nope.
Great. John, I'm going to listen to your lung sounds. I'd like for you to take a deep breath in and blow it away. I hear vesicular breath sounds bilaterally in all lung fields, no adventitious sounds, no crackling, no wheezing. Sounds great. I'm going to go ahead and have you turn back around for me. Inspecting the anterior portion of the chest, I'm also looking for the color, noting any abnormal respiratory effort, any use of accessory muscles, all of that looks normal. I'm going to check for tactile fremitus.
99, 99, 99, 99.
Sounds great. I'm going to percuss the intercostal spaces again. And all of that is resonant bilaterally as well. I'm going to listen to your breath sounds again, Jana, on the anterior. And nice deep breath in and out. Pulling sounds are nice and clear. I see here vesicular breath sounds bilaterally, no wheezing, no crackles. I'd like to listen to your heart sounds now. I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Noting S1 and S2 are both normal. I hear no bruise, rubs, or gallops. Jean, I'm going to ask you to lay down. Okay, Jean, I'm going just to look at your chest here and make sure that I see no heaves or thrills. That looks great. I'm also going to palpate the point of maximum impact. And you can compare this with the carotid artery. And this is best felt at the apical, and this they both feel equal. Okay. I'm going to pull your gown up here, Jana, so I can look at the aortic pulse. And I see no aortic pulsations, no abnormalities there. Great. Okay. Moving on to the abdomen. I'm going to inspect the abdomen first. The color is normal coloration. I see no pulsations or hernias. Sean, I'm going to have you lift your head up, and I'm checking for abdominal muscle tone. The umbilicus is appropriately midline. I'm going to auscultate for bowel sounds in all four quadrants. Bowel sounds are normal active. Moving on to light palpation. Any pain? Okay. If the patient tolerates, with palpation, you're wanting to feel any enlarged organs or tenderness. If the patient tolerates light palpation, we'll move on to deep palpation. Any tenderness?
Nope.
Okay. Next, we'll percuss the abdomen. You should hear tympany in all areas of the abdomen. And then we will percuss the liver border. That is on the right costal margin. You are going to percuss from tympany to dullness. And then that should be a span of approximately 5 to 7 centimeters. And then the same for the spleen, which is on the left side. And you are going to palpate for splenic dullness on the left costal margin. You're also going to palpate for palpating your liver. Liver is sometimes palpable, and if you do palpate the liver, it should feel nice and smooth and actually could glide underneath your hand. Palpating the spleen on the left costal margin, the spleen should not be palpable. I'm going to palpate your kidneys. I want you to take a deep breath in. Okay? And the right kidney is usually larger than the left kidney. And same for this side. Okay. Shauna, I'm just going to auscultate the arteries, starting with the aortic artery. Using the bell of my stethoscope. Aortic. I'm listening for any bruits. Renal. Iliac. And femoral. No bruits heard on any of those. Okay. Shauna, I'm going to move on to your legs. I'm going to assess the skin and hair distribution on your legs, noting any bony abnormalities, none seen. I'm going to assess the strength of your legs. Can you bend your legs? And push against my hand. And again. And your other leg. And again. Okay? And then this way. Checking hip and leg strength and push. And this leg. Okay. All right, Shauna. You can go ahead and I'm also going to palpate your femoral arteries and the inguinal nodes. Great. Those are both 2+, and I cannot palpate no enlargement of your inguinal nodes. Palpating your dorsalis pedis pulses. Both are 2+. The tibial and popliteal. Both are 2+. And go ahead and push against my hand here. We're going to test your muscle strength here and push against. And again here and against. Checking your reflexes on the knees and the Achilles. And radial. Few more fine motor skill tests to finish up the cranial nerve assessment. Shauna, I'd like for you to, these are assessing fine motor skills, take your thumb and your finger and bring your thumb and fingers together. Great. And then with your hands, alternate as fast as you can onto your legs. Great. That's assessing fine motor skills. Take your heel, and I'd like for you to rub it against your shin on the opposite leg. Heel to shin. Great. And your other leg. Great. Okay, Shauna, I'd like for you to stand up for me. Okay, Shauna, I'd like for you to bend over. I'm going to assess your spine, making sure there's no curvature of the spine. Looks good. Stand up. I'd like for you to lean back as far as you can. Okay. And then twist to the side, each side. Okay. And then bend over to each side. Great. Finally, we will end with the Romberg test. I'd like for you to put your arms straight out with your palms up. Close your eyes. And here we will make sure there is no deviation of the arms while the patient's eyes are closed. And this is a negative Romberg test. That concludes our head-to-toe assessment. Thank you.